is exercise as a medicine, you know. So you've been practicing for more than 20 years, you know, and this is a favorite topic that you wanted to talk about. So how do you see exercise as a medicine? How should, very generically speaking, how should one approach to exercise as a medicine?
Okay, excellent question. Exercise as alternative medicine, exercise has lots of benefits. It not only helps us stay limber and helps us keeps our muscles from getting tight, but exercise has lots of benefits. It reduces the risk of cancer, obesity, heart disease, and it is the only form of medicine that has been researched to maintain or uh, even improve cognitive levels in Alzheimer's dementia and Parkinson's dementia. So overall, it has ton of benefits, and we just need to make time to exercise more often. So, like the studies have shown that the average screen time, besides work, of the average screen time for people is 7.5 hours these days. And this is based on studies. So, why can't we take an hour out of those 7.5 hours? Or if your screen time is even 2 hours, if you take an hour off to exercise, it will help with, overall improving your cardiac capacity and the flexibility of your body. And it will keep your muscles from getting tight. And most importantly, it will help maintain cognition, especially for people who have dementia and things like that. And it actually helps prevent a lot of illnesses. And this is based on studies. It also helps prevent high lipid levels.
So you mentioned about, injuries, that are caused, and, emergency care, and other kinds of accidents, So typically, what are some of the emergency response, techniques that people should learn, just to, as a matter of care in those situations? You mentioned about that, but that's something that one would like to hear from you.
Are we talking about repetitive strain injuries? Okay, so for repetitive strain injuries like carpal tunnel and things like that, or even your tennis elbow, and it is better to contact your physician right away and seek care, because again, based on research, if you seek care for repetitive strain injuries like carpal tunnel, after 6 months, the prognosis is not that as good. For any other hand injury that occurs while cooking, like a tendon injury or a nerve laceration, it's better to go to the ER right away. Or fractures also.
The next question is, what would you recommend one should do, as everybody is sitting long hours at home, so it's not possible to avoid computer time? So what would be your recommendation to them?
Is this question from the United States?
It is, incidentally.
Oh, great. So I feel like here in the United States, we are lucky that at least we can step out of our homes, and we don't have to be in a lockdown like people from countries like India. So I can share what we are doing. We wear our masks. We try to step out during times when there are not too many people around and go for a walk. If you want to make it interesting, change your route each time. Go for a walk, run, or even go cycling. But walking is very safe. You can do 20 minutes of walking at a start off at a very low intensity. And every 20 minutes, 20 to 30 minutes, try to do the exercises I showed you. If you have to use the computer, at least alternate between sitting and standing every half hour.
Okay, so the other question is how much can massage help in reducing pain?
Excellent question. Massage can help a lot for acute pain, but some of the things I'm going to tell you are based on research. So based on research, massage and passive modalities that are used by therapists like the TENS unit or heat packs do not help as much. So one of the biggest benefit of massage would be the relaxation, and that may help you with the perception of pain. Also, touch signals. The most important thing to understand here is that finally it is our brain that interprets the pain, and touch signals travel to the brain faster compared to pain signals. So the touch signals can block the pain signals traveling to the brain and decrease your perception of the pain. And generalized relaxation helps chronic pain. So massage may help you indirectly. But what I would recommend is, especially if you've had chronic pain, which lasts longer after the injury, even after the stimulus has stopped or even after the body part has healed, you may experience pain. So for that, use all these passive modalities like massage or a heating pad or a TENS unit to for that to be your motivation to move the joint. So let's say if you have a stiff hand, after your massage, move it. Be gentle, start off gently, but motion is lotion. And the more you move it, for chronic pain, it helps with the mapping in the brain, and we can watch the video soon.
Okay, so this question is more for the teenagers. What exercise would you recommend for younger or teenagers, younger kids or teenagers, to prevent injuries related to overuse of computer, phone, etc., and what exercises they can do to improve posture?
Okay, so excellent question. So in general, for adults, the dosage for exercises is 150 minutes of moderate intensity exercises. For teenagers, it's twice as that. So it would be 130 minutes of exercises. And let's talk about intensity. So what do we mean by moderate intensity? So the intensity of exercises can be classified as mild, moderate, and vigorous. Mild exercise is when you can sing and talk without difficulty. Moderate difficulty is when you can either sing or talk. And vigorous intensity is when you cannot do either. You cannot sing or talk. So if the teenagers are in the United States, they can go out for a jog or a run. My daughter goes for a jog and a run. She tries to step out when it is not so busy. The streets are not as busy for safety during quarantine. My teenager has an input for this.
Every 15 minutes when you're using your phone or your laptop, you need to look up and stretch your neck, because if you're looking down or even if you're looking forward, it's still not good. You're straining your neck muscle. You need to look up, and the nerves in your neck will lead down to your hand in the end. So there's that. Another thing is to not go on your phone for more than an hour. It's hard, but just set a timer on your phone or something. And then when that timer rings, you have to just
end it.
Mhm.
There are also apps to limit phone usage. But for posture exercises, I showed those simple exercises. But the shoulder blade is like the foundation of the arm. So my daughter, I recommend shoulder blade strengthening exercises to my patients and my daughter. So she does those as well. Does that answer your questions? Or there are lots of things you can do.
Yeah. So let's move to the next one. I think
Sure.
that's pretty much what people are looking for.
Sums it up.
There's a question from, uh, which is basically how many of us now use large screen iPhone, which is iPhone 10 and so on for many hours. What can we do for posture? Any equipment?
Yes. Uh, the bigger phones, when you hold them, like the American Society of Hand Therapists videos showed that the constant gripping is not good. When you're with bigger phones also, you're putting too much stretch on the median nerve that passes through the carpal tunnel. So these pop sockets help because then you don't have to grip. You can just slide your fingers like so. There are also elastic bands that are called lazy hands where you can grip the phones like that. There are stands for iPads and iPhones as well. But in my career in the past decade, since smartphones became popular, we are seeing a lot more injuries and problems, pain-related issues. We have there's something called as decurvain tenosynovitis, which is tendinitis of the tendons by the thumb. And in the past, it used to be called mommy thumb because even I got it as a new mom from picking up my baby. But now it's called the BlackBerry thumb because people get it from texting. Ideally, no matter what iPhone you have, try not to use your thumbs to text because our thumbs are meant for strength-related activities like gripping and squeezing. They're not designed for dexterity. Oh, good job, Mr. Somnath. You're using your fingers.
Okay, so one more question here. When you're in pain, till you get the needed help, how to decide the body part to move or not? And what are some of the generic guidelines you can share?
Okay, and which body part are they talking about?
That's something, it's not mentioned here.
Okay,
We can probably focus on the upper,
on the question. Okay, so if your pain is severe, it could be anything. It could be a fracture, it could be something more severe. So ideally seek medical help and try not to self-diagnose. And there are a lot of physicians doing telehealth visits as well. So I would seek medical advice.
Okay. So the next one.
Unless you're very sure it's just stiffness from too much screen time, then you can try to, or static postures, then you can try to move it gently if it is mild pain.
Right. So what are the benefits of hot versus cold compress?
Okay, so there are different stages of healing actually. So there's an acute phase, then which lasts for about a week, and then there's an inflammatory stage. So I've heard a lot of therapists suggest that use what helps you with pain, but for acute pain, what we recommend is in the acute stage of healing, which is the first few days, use a cold pack to prevent the swelling from getting worse. And after that, when the healing goes into an inflammatory stage, which is after the first 5 days. After the first few days, try to use a heating pad to help with increased blood circulation and things like that.
So there's another smartphone question, which says, are you aware of, or can you recommend any kind of smartphone stand so that we could use it standing?
Yes, my nephew has a stand like that he can use it standing up.